Tonight, the Texas Health Commissioner thinks most hospitals can't handle Ebola patients. His announcement comes as officials confirm a fourth case of Ebola here in the United States. A doctor in New York who recently worked in the West African country of Guinea. El Paso health officials, though, say they're as ready as they can be. Texas Health Commissioner Dr. David Lakey spoke during a first-ever hearing of the state task force addressing Ebola. He said the experience in Dallas shows not every hospital in the U.S. can cope with the virus.
The rest of the nation is looking at what we're doing here in Texas, what our lessons have learned after applying CDC's protocol, figuring out how they can improve that, and how that can be applied through the rest of the nation.
ABC 7 reached out to local hospitals for their response, but none could or were able to give comment.
They all have a basic minimum level of preparedness, and they've had since 2001, the 911 issue, when we had smallpox scares and anthrax scares, and the vestments that they need and the respirators, those have been in place since the anthrax scares.
The city's Department of Health director said to the media on Monday, all El Paso hospitals follow the CDC protocols for handling Ebola.
And I believe that was less than a week ago when the CDC comes out with new guidelines. We blast fax it to all the hospitals and over 500 physicians in El Paso.
Governor Rick Perry formed the task force once the Ebola case was confirmed in Dallas late last month. And 2 biocontainment treatment centers have since been established near Dallas and Houston.